Any other questions? So one from Dubai, actually, Asif. Need a microphone.
Yes, this is a question sent by Dubai group. They're saying, I think it's in relation to cirrhosis talk, and the question is that given a patient with liver cirrhosis, what should be the cutoff point for normal renal function test? I think you did touch on some of that, but could you kindly elaborate a little bit more, please?
I think, so first of all, I'd be more than happy to come to Dubai and answer that question. Never been, heard it's lovely. But I think it is very useful if you have a baseline. Most of our patients actually will have had renal function done at some point before they get admitted to hospital. And I think unless you know a historic measurement, it's reasonable to assess what happens over that first 24, 48 hours, because if it's within the normal range but abnormal for the patient, then unless you're specifically treating them in terms of fluid resuscitating them, then you'll find that it continues to deteriorate. So if you don't have a historic level to compare with and look for a 50% increase, then you should be looking at what happens over that first 24, 48 hours. Because if it's abnormal for the patient and you're not doing anything, then you'll find that it continues to deteriorate. So there's no absolute cutoff that's normal. You have to look at the end of the bed at the patient. The malnourished sarcopenic patient, you would expect to have a low creatinine, but it's difficult to quantify that as being a specific individual cutoff for patients with cirrhosis.
Thank you. Can I just ask kind of a slight extension of this question? This is, again, people have been looking at other substances like cystostatin, clearance, and so on. I mean, are you using that in any clinical practice so far?
So we're not using these in routine clinical practice, and there's ongoing searches for what the correct biomarker is for renal function in cirrhosis, and also for biomarkers that can distinguish hepatorenal syndrome from other causes of renal dysfunction in patients with cirrhosis, because obviously that is an important distinction to make. But at the moment, there's nothing that's made it from the lab and research into the bedside.
Thank you.
And we're just going to finish. There was one comment from Dubai. Asif, if you want to just make a comment quickly to finish off.
Actually, yeah, it is a comment, and I think it's for our speaker on the on the Dr. Barclay. You talked about going to Dubai. In fact, you have an invitation to Dubai.
Well done. Anyone else want to make a pitch for Dubai?
And it comes from Dima Abdul Manan, who is in charge, and I will be going with you.
Okay, well, that's a very positive thing to finish on.